Mono really will wipe you out. I mean, it is one of those that I tell my patients, if you had mono, you would not be able to raise your head off the pillow. You are just so fatigued.
It is a virus, so patients have to let it run its course. It's not something that we can treat with any kind of medication or anything like that.
They have to rest. I mean, the more energy they expand, the worse off they're going to feel. So they have to rest.
Today we're going to do a mononucleosis test. Mononucleosis is a contagious disease caused by the Epstein-Barr virus. This can be an extremely contagious disease.
Mono is called the kissing disease because it is contagious and it can be spread through kissing. So a lot of times what they'll say, especially to younger people who get mono, is who have you been kissing?
Some of the signs and symptoms of mononucleosis can be fevers, chills, body aches. They can get an enlargement of the spleen. They may also have a sore throat. So mononucleosis can be detected in the blood using a pre-made kit. This is a simple procedure that can be done in office. We do need to get a blood sample from the patient, and today we're going to do a finger stick, which we're going to do right now.
The mono test is actually a finger stick. It's a blood test. It's not a swab. They actually take a couple drops of blood out of your finger and put it into a little reagent area. It looks almost like a pregnancy test. You put a couple little drops of blood into a cassette and you add a reagent, and then it will automatically test for the monovirus. It's very quick, it's very easy. Probably the worst part of it is the finger stick, because people would sometimes rather have their blood drawn than the capillary stick because it hurts.
Okay, to do our procedure, one of the first things we're going to need is a lancet. These come in various shapes and sizes depending on the manufacturer. So depending on the place where you work, you're going to have different ones. We're going to have some simple gauze pads. This we're going to use to apply the alcohol to cleanse the patient's finger and also to control any bleeding as necessary. We're going to have a capillary tube. Now this capillary tube comes with the specific mononucleosis testing kit that we're going to use today. And we're going to fill this tube to this blue line with the patient's blood. We're also going to have a Band-Aid that we'll use to apply to the puncture site after the procedure is finished. And in our bottle of alcohol and sharps container. And that's it. All right, let's get started with the patient. First thing you always want to do is make sure you have the right patient. So please tell me your full name and your date of birth.
My name is Sarah Menendoza and my birthday is September 1st, 1980.
And then you want to explain to the patient what we're going to do. We're going to be doing a finger stick. We're going to get a small amount of blood that we can do a mononucleosis test on you that the doctor has ordered. Just going to make a small puncture in your finger and we're going to fill a small little tube with blood. Okay, ready to get started?
Yes.
All right. Now, the first thing we need to do is we need to choose a finger. It's best to use the patient's non-dominant hand, okay? And we want to use either the middle finger or the ring finger, okay? These typically tend to be less callous and the blood may flow a little easier from that. Also, if the patient tends to have cold hands, you can have the patient warm their hands under some warm running water. Will really help facilitate the blood flow. Pick a site that's off to the side of the finger. We don't want to go right at the tip of the finger. It can be very painful for the patient. So right in this area is usually good, okay? First thing we need to do is to cleanse the area. So we're going to get a liberal amount of alcohol and we're going to clean our puncture site. Now, we don't want to go on the bottom part of the finger. We want to go more towards the side and just give it a good clean with the alcohol. Okay, I'm going to let that air dry while we get everything ready. And it's important to have a piece of gauze and your lancet ready. And just remove the cap from the lancet. Be careful, it's a sharp object. And then what we want to do is just simply, on the side of our finger, just make a quick puncture and pull it away.
Put the lancet into the sharps container. I know that a lot of times students get sidetracked and they start thinking about their patient, but setting that lancet down and not putting it in the sharps container could possibly put the MA at risk for injury, because if you stick yourself with something that you've already stuck somebody else with, then you have exposed yourself to anything that that patient might have.
Now the first drop of blood that comes from the finger, okay, you bend your hand down a little bit, all right? We want to wipe that away because it's going to be contaminated with epithelial cells from the skin, okay? And then we get our capillary tube ready, and it's as simple as touching the tube and letting it fill. Now we can apply pressure to the finger to help with the blood flow, but we do not want to milk the finger. So we keep working the finger to get the blood going. And you can see that we're almost there. Okay, hold your finger on one end of the tube to keep the blood from coming out. Give the patient a piece of gauze, and please put pressure on that for a couple of minutes. And that's it. Now we're going to do the actual testing on the blood sample that we took from our patient. Every kit comes with a sample card, and it's individually foil wrapped. And all you got to do is open this up and remove it from the wrap, and you'll see a well that's marked with an S on this particular model, and this is where we're going to add the patient's blood and the buffer solution that's going to perform the test. On this side you will see a control and a test area, and this is where it'll indicate whether the test was positive or negative. Every test kit comes with its own procedure card, and these are very simple to use, and it explains in a step-by-step process on how to do the procedure in its entirety. Okay, we're going to take our tube of blood that we collected from the patient. We're going to affix this rubber stopper to the end, and then cover that with your finger, and then add the entire contents to the sample well of the card. And then we allow a little time for the blood sample to get absorbed into the test kit. And then we're going to add 1 drop of this buffer solution per the procedure card that comes with the test kit. Okay, we're going to note the time, and this test, per this manufacturer, takes 5 minutes to complete the test. After the 5 minutes of time, you want to check the test results, and you want to compare what you see on the card to what you see on the procedure card that came with the test kit. We can see that we have 1 faint red line under the C, and if we look at our procedure card, you'll see that that indicates negative. That's what we expected on our patient because she had no signs of having mononucleosis. After completion of the test, it's important that this go into biohazard bags, but the capillary tubes and the lancet have to go into the sharps containers.
The other thing is too, it really helps with return visits. If we have a diagnosis immediately while the patient's there at the office, they're not coming back every day saying, I'm not getting better. So we're getting diagnoses a lot quicker while the patients are there in the office, and they can be treated a lot quicker, and they don't turn into things that become real dire issues.